Thank you for being here. My name is Dr. Stafanie DuPaul, and I am a physical therapist. I do orthopedic, sports, and pelvic floor physical therapy. I own Boston Health and Wellness, which is located 30 seconds that way. It's at 62 Montvale Ave in Stoneham. It is right next to the Dunkin' Donuts and the Play It Again Sports. And there used to be a nail salon that was called Zaza right next to me. It's now called L'Amour. But we're very happy at that location. We're really busy. It started out on November 1st, 2020, so 3.5 years ago I started my practice. It started with just me and my dog, Samuel Adams, who also has a business card. It's just me and Samuel at the beginning. Samuel Adams is an emotional support animal and a psychiatric behavioral dog. So he would come with me to work every day, and we'd treat the patients, and then I hired a front desk, and then I hired an aide, and then I hired a BTA. And it sort of went from there. We started with just orthopedics and sports. That's what I've been doing for the past 13, 12 years. I've been a PT. And, you know, I loved orthopedics and sports. I loved shoulders and hips and knees and backs. And I was comfortable doing that. Like, this is what most PTs, when they go to school, they say, I want to help athletes and I want to do sports, right? Not a lot of people go and saying, like, I want to fix pelvic floors and stick my hand in places. You know, like, that's just not, but I don't know. It's sort of, the field is changing. So I started orthopedics and sports. And then I got married, and I started this office November 1st, 2020. And then we decided to try to have babies. I had to undergo a round of IVF, unfortunately, but it did work. And yay, I know, thanks. And that's Christian, he's 2 and 3 months, so he's 27 months. However, Christian had a head that was in the 99th percentile, and he was my first baby. So, you know, I'm a pretty athletic person, a pretty competitive person. So I sort of trained for this childbirth, even though I didn't know much about pelvic floor PT. You know, I did stretches, I did strengthening stuff. I was like, I'm going to push this baby out. I've run 15 marathons all over the world. So I am a pretty, you know, when I want to do something, I will get it done, and I'm pretty competitive about it. I did go to UMass Amherst for my undergrad and Northeastern University for my doctorate. So yeah, so I'm pretty athletic, I'm pretty competitive. So Christian, I was giving birth, 21 hours of labor, and we were sort of at the end, and his heart rate was dropping, and they said, if you don't get him out in the next push, we have to do an episiotomy and cut you open with scissors. And I was like, there's no way, I am not pushing him out. So I turned into the Incredible Hulk, and he came flying out, and I ripped in 3 places and needed 36 stitches.
Wow.
So that was sort of what led me down my pelvic floor journey. At the time, I was like, what just happened? I needed a lot of, you know, stitches, lidocaine, whatever. And it's crazy. I was like, it's the one part of my body I don't know how to fix. I can, like, if anything else got injured, I can probably figure it out, but I don't really know this area. So I gave birth, I healed pretty quickly, actually. It's amazing how fast that area heals. So that sort of led me to, I said, you know what, I need to get pelvic floor certified. Immediately, enough is enough. Like, I need to help women like me or not like me, but like that just, I literally didn't know where to turn or who to ask or what was happening with my body. So that was what led me down my pelvic floor journey. And Christian is amazing. He still has a 99% head. And I'm pretty proud that I got him out. And everything is back to normal. And then we were able to get pregnant the second time the natural way on our first try, which was pretty cool because we struggled so much the first time. And that's David, and he is 10 months old. And only 2 stitches that time. And yeah, anyway, but I've had every type of pelvic floor dysfunction there is, and we're going to dive into the different types. I've had weakness, I've had tightness, and I've had a mixed pelvic floor. So I personally know how to fix all 3. So I can speak to it. I'm happy to discuss it. I'm happy to discuss childbirth, and because I've also been through that. Yeah, it's a pretty cool journey about the pelvic floor. So we're going to dive right in. okay? So when I see a patient at my office, usually they come in, they have no idea what to expect. You know, they're like, is this like the OBGYN? Do I have to put my feet in the things? You know, like, so I always say on the phone when I schedule the appointments, I say wear comfortable clothing, come about 5 or 10 minutes early for paperwork. You will be alone in a room with a physical therapist. And there's a history, there's an anatomy, there's an education portion. There is a pelvic exam. It's about 5 minutes where you do remove your clothes from the waist down. If you're comfortable with that, great, let us know. And if you're not, you can always waive the pelvic exam or say I want to do it a different day or whatever. And then we go out on the floor for your treatment. So this way we're able to see patients through insurance. And we have sort of like invented, I don't know if invented, but created a functional pelvic floor program at our office, because most pelvic floor physical therapy is cash-based. It is out of pocket. It is very expensive. It's about $250 to $400 a visit, which like, that's a lot of money. And it's not really fair that you can get your shoulder worked on through insurance, and just because it's your pelvic floor, like you have to pay $400. It's just, I was like, I need to fix this. I need to figure out a way to help people that can't do this. Because like, I had 36 stitches and I didn't know where to turn, you know. So I've sort of invented or created this functional pelvic floor program where we can see patients through insurance, and we can, we don't have to do the cash-based thing. We're not alone in a room for the full hour. And there's not like some places have a 3 to 6 month wait list, which if you just had a baby and had all this trauma, you can't wait 3 to 6 months. Like, you need to get in the next week or two. So we do have usually a 1 week wait. So we're doing a pretty good job, and that's why I just keep hiring more people. And we might need to start another location soon. So it's pretty popular, and it's definitely needed. So yeah, let's dive into the pelvic floor, shall we? So patients will come in and they will say to me, Stefanie, I don't even know what the pelvic floor is, right? And I'm like, I have no idea. So I love these patients. These are my favorite patients because I sort of have an open platform to just go nuts, right? So this is a pelvis, okay? So this is great, right? Yeah, good. Pelvis, okay? So I'm going to take the organs out really quick. Okay, I'm going to take all your organs out. Okay, so, oh God, I know. So anything that you see that is white is bone, okay? This is your bony pelvis, right? So you have your pelvis, you have the bottom of your spine, which is your sacrum and your coccyx. Anything that is white is bone. Anything that you see here that is red is your pelvic floor. So it's like way bigger than most people think. Like I don't know what people think the pelvic floor looks like. This is your pelvic floor. Everything that is red is considered your pelvic floor.
Is
Okay?
this to scale? Is this like the actual size?
It's a little smaller, but it's close. Yeah, good question.
If you're 5 foot, it's pretty good.
Yeah, I mean, like, it's pretty close. Yes, I don't want to say it's exactly the scale though. So the definition of the pelvic floor is the muscular hammock or sling that underlines the surface of the bony pelvis, okay? So there's a lot of muscles right there, right? So I don't want to jump too off topic, but if you look, this is a female and this is a male. Like, we have the exact same muscles for the most part, except they have a few extra ones that raise things and drop things. But as you can see, right, like we have 2 holes, they have 1, right? But like where the testicles are where our other orifice is. But it's pretty similar. So treating males and females is actually like easy because we're so similar anatomical. Okay, so that's a good picture of all the muscles. So, muscular hammock or sling that underlines the surface of the bony pelvis. On top of our pelvic floor, we have 3 major organs. Okay, you have your rectum that sits in the back. It's the end of your large intestine. You have your uterus and cervix that sits in the middle. And then you have your bladder that sits in the front. Your bladder is pink, it's smooth, it looks like bubblegum or silly putty on the inside when it's healthy. When it's irritated and overactive, it gets mad at you and red and it looks like it's on fire. Bladder irritants are carbonated beverages, spicy foods, alcohol, citrus, and caffeine. So basically anything that's fun messes up your bladder and like makes you feel like you have to go when you actually might not have to go. and sort of creates an urge incontinence, which we will go over that later. When you drink water through your mouth, your bladder fills to about 200 cc's. I'm trying to make it so everybody can see. 200 cc's of fluid. You get the first signal to your brain of, I have to pee. You're actually not supposed to pee. You're supposed to wait and hold and train your bladder that it's not actually full and you shouldn't be going. So when you go to the bathroom, when you don't have to go, that's called jicking or just in case peeing. J-I-C, jick, right? So like, do you remember when you were a kid and your mom would say like, why don't you go try before we get in the car? That's actually not great. You're not supposed to jick. You're supposed to like, I mean, if you're a kid, fine, but adults aren't supposed to jick, okay? So we're supposed to actually wait until our bladder is completely full. And the reason for that is if we continue to do that, we mess up the signal from our brain to our bladder and it starts to think it's full there when it's not, and then we have to go all the time and it creates an urge incontinence. Here we are. Welcome back, everyone. I hope you enjoy your lunch. Okay, so we were just getting into the anatomy of the pelvic floor, which is so exciting. All right, so we're gonna go back to the bladder, okay? So we did the whole white is bone, red is muscle. This is your bladder. It is pink, it's smooth, it looks like bubblegum or silly putty on the inside when it's healthy. We went through that whole spiel. Anything fun makes it mad, right? So we're going into the drinking water in through your mouth, okay? So when you drink water through your mouth, your bladder fills to about 200 cc's of fluid. It's only like part of the way full. It's not even half full. You get that first signal of, ooh, I have to go to the bathroom. You're actually not supposed to go. You're supposed to hold your pee because your bladder is not full. Like, I could probably go pee right now. I'm probably at 200 right now, but I'm not going to get up and go, you know? Like, I'm here with you guys. Like, I'm going to hold it and train my bladder. Unless you're pregnant, then you sort of, and I'll explain why later, but all bets are off when you're pregnant. You do whatever you want to do. I just had 2 little babies, and boy, was that interesting and amazing all at the same time. So yeah, when you get that second signal, so when you drink more water, you fill to about 400 cc's of fluid, okay, 400. You get that second signal of, ooh, I have to go to the bathroom. That's when you're supposed to go, and you're supposed to sit with your feet firmly on the floor or on a squatty potty, okay, something, you don't want to be that person that's like hovering and spraying the seat, oh my god, those people, and then you like, it's like pee everywhere. Don't hover, okay, sit firmly on the seat. You can lean forward slightly if you don't have a squatty potty. If you do have a squatty potty, it sort of brings your legs up, but what it does is it puts your pelvic muscles at the most relaxed position, so it doesn't restrict your flow, okay? You want to take deep breaths. You never want to push. So I know, like, sometimes if your kid is crying or you're at work and you're trying to pee really fast, like, you go in and push it out, like, do not push, okay? Like, that messes with your pelvic floor, too. Do not push your pee. Deep breaths, and you're supposed to be able to count to 10, and that means your pelvic, or your bladder was full, and you fully emptied your bladder. If you do not make it to 10, you wasted one of your pees for the day, and you actually did not have to pee. Okay, so people, like some pelvic floor PTs will give you a cup to measure. I don't do that, because then you like pee all over your hands. It's just like a mess. No. So just count. I think it's easier to just count. So if you get to 5, that means you're at 200 cc's. If you get to 10, that means you're at 400 cc's. If you get over 10, that means you were over that. Whatever. You should be at 10 plus, and that means your bladder was full and you were supposed to go. So I've ruined peeing for everyone, because they're like, every time I pee, I count. But like, I think it's good information. Like, so yeah, I'm always a 10 plus these days because I do this for a living. But yeah, so normal amounts of times to pee a day. People ask, oh, what is normal, right? 5 to 8 is normal, which is like not very many pees, you know, like, right? Like 1 in the morning, 1 before bed, and you only get like 3 in the middle, you know. So yeah, you really shouldn't be peeing that frequently. 5 to 8 is normal during the day. At night, 0 to 1 pees is normal. So you get up 0 times or 1 time. And then you should be able to hold it for 2 to 4 hours without having to go. So like, if you just went 30 minutes ago, unless you're pregnant, you shouldn't have to go again. So these are ways to gauge it, like, oh, I'm gonna wait, I'm gonna hold my pee, and I'm gonna train my pelvic floor and my bladder so I don't create an urge incontinence, okay?
Does that depend on how much water you're drinking? So if you're
Yes,
drinking
if you drink
more-
a ton of water, it'll be slightly more, but that's like normal amounts of water, yes, those are the norms, which you might be if you have more water, it'll be slightly more. It might be 6 to 9 times, or, yes, that's a good question. Not much more, yeah. So, okay, I went off on a tangent, sorry. Okay, and then if you get to 500, that's too much. That's like dancing your pants hurts on the highway when you're like, I gotta pull over. Don't wait that long. That's like, don't be mean to yourself. That's your bladder, that's organ number 1 that sits in the front, on the anterior portion or the front part of your pelvic floor, right here, okay? So organ number 2 is your uterus and cervix. So this is your cervix, this is where things go into. Uterus is way up here, which is the house where babies grow for 9 months. Very safe at the top. Fallopian tubes and ovaries are here and here. If you look inside, that's sort of what it looks like in there. There's blood flow and vessels for the baby to grow. So people ask if they can have intercourse when they're pregnant. Yes, you can. They'll ask if it pokes the baby. No, it does not. When they check how dilated you are, it is way up here. So they check way up high. It's not fun. So this is a really heavy organ, and when you're pregnant, the uterine walls get really thick, making it even heavier. Plus the baby, the weight of the baby could be 8 to 10 pounds. The placenta is really heavy, all the fluid. It's a lot of weight, extra weight, sitting on the front half, the anterior portion of your pelvic floor. And look where it also sits, on top of your bladder. So when the baby moves or kicks or anything, it just kicks your bladder, and that's why when you're pregnant, you're like, I gotta pee, I gotta pee, I gotta pee. And that's why all bets are off when you're pregnant, okay? So if you see here, bladder, uterus, cervix, okay? That's all in the front half. And think of how much weight is on that muscular hammock or sling. Plus, when you're pregnant, we have hormones. We have tons of hormones. And one in particular is the relaxin hormone, which helps everything relax and open up so we can give birth, okay? So that's happening too. And then you have your rectum that sits in the back, okay? So this is all your stool contents, all the food comes out through the back portion of your pelvic floor. So the reason I spend so much time talking about the organs of the floor is people don't associate the muscles with the organs, okay? So if there's anything wrong with any of these organs, not wrong, but going on with it is what I should say. If you have a UTI, if you're growing a baby, if you have constipation or IBS, which is irritable bowel syndrome, it sort of messes with the muscles that it's passing through, right? Because all of these organs pass through the floor. So I'll give you an example, okay? So if you have a herniated disc in your back, right? The muscles around the disc get super tight to sort of protect the disc, right? So same thing happens with your pelvic floor. If you have anything going on with these organs, the muscles will probably get really tight to sort of protect as a defense mechanism, or they might get really weak from the relaxin hormone and the weight of the baby. So there's a lot of everybody has some type of pelvic floor dysfunction, if you will, some level of it. Yes?
What about endometriosis and significant cramps?
Yeah, so that's definitely affiliated, absolutely. And that would make your pelvic floor musculature react. Yes, absolutely. Endometriosis, we do a lot of endo. And we will get into that when we get into like conditions and stuff. But yes, that is a very good point. And yes, that does affect your floor. Great. So those are all the organs inside that affect the musculature at the bottom. Okay? Does that make sense to everyone? Mm-hmm. Cool. So now we're going to jump to the front. Okay, I'm going to take these out so they don't fall all over the floor. Okay, so in the front you have your pubic bone. Okay, in between you have your pubic symphysis, which is the cartilage in between the two bones. So right before, at the end of your pregnancy, it will start to open up. And it's called lightning crotch. Not comfortable right before you have a baby, but it's when everything opens up so the baby can pass through the birth canal safely and you can give birth. This is your clitoral hood, which is the hood on top of the urethra, which is the hole that you pee out of. which is right here. This is the introitus, which is the opening to the vagina. This is your perineal body. This is your anus. This is your levator ani muscle. And this is your bulbospongiosis or your bulbocavernosus muscle. Easy to remember because it looks like a light bulb. So when you do a Kegel exercise, everybody wants to talk about Kegels, but we will talk about Kegels. When you do a Kegel exercise properly, your clitoral hood should nod, your perineal body should lift, and your anus should wink, and that means all 3 zones of your pelvic floor are firing, and it might just be too weak or too tight. Any questions about the pelvic floor anatomy? Fascinating, isn't it? I know, it's pretty cool, so I'm sure you have a ton of questions. And we are saving the end for like private questions with the camera off. Sorry guys. So if you want to like share something off camera, we'll do that with you. Cool, but this is basically the anatomy of your pelvic floor. Do you guys understand what your pelvic floor is way better now? Mm-hmm. I know, it's so amazing, right? People walk out of the eval room and they're like, whoa, that's like a lot of information like in a short period of time. But I only have like an hour on the first day with these patients, so like I gotta get it in there. Yeah, and then the other thing, okay, I don't want to go off on a tangent. We're gonna keep going, all right? So, bladder, uterus and cervix, rectum, pelvic floor. Cool, we got it? Okay. So then I do that first with my patients. So they're like, oh, now I know what the pelvic floor is. Okay, cool, now let's talk about it, all right? So then I go into, there are 3 types of pelvic floor dysfunction, okay? There is a weak pelvic floor, that's bucket number 1. There is a tight pelvic floor, which is bucket number 2. And then there's a mix, which is a combination of the 2, right? So that's the 3rd bucket, all right? Weakness is associated, the symptoms are, I usually, when I run, jump, cough, or sneeze, I pee a little bit. I can't hold the urine in. Weakness, yes. And this is why this is good, because when your friends tell you things, you can be like, you have weakness, you know, and you can diagnose them in seconds. So when you give birth, sometimes, or when you get older and the muscles start to weaken and you're not as trained, a lot of weakness happens to the pelvic floor musculature, and you can develop something that's called prolapse. So some people have no idea what prolapse is. When I talk about it, some people get a little nervous. It's okay. It's very, very common. So prolapse is when one of your organs starts to slide down the vaginal canal and the vaginal walls get weakened, okay? So your bladder can sort of slide down out of place. So this is a normal, and I'll pass this around. This is normal anatomy of where the organ should be. Bladder can slide down, or your uterus can slide down, or your rectum can sort of slide down into the vaginal canal. So when we do an exam, we actually see pink tissue that is not supposed to be there. That's with very severe cases of weakness, okay? So, and it's very common, and it's okay. And you can fix it with pelvic floor PT if you have certain levels of it. So this is my prolapse chicken. Very cute. Okay, so this is grade 1 prolapse. So the organs are still inside, but you can see the tissue coming down the vaginal canal. Okay, grade 2 is if it's slightly outside of the walls. Grade 3, and this is a 4, right? Woo, way outside of the body. So pelvic floor PT, we can fix a 1, 2, and sometimes a 3, but a 4, you usually need a surgical mesh and surgery to get everything to go back up. So yeah, most people don't even know that prolapse exists, but it does exist. It sort of feels like you have a tampon that's falling out, but you don't have one in. And it's actually one of your organs that's sliding down. So I will pass this around so you can all take a look at it. So that's associated with the weakness bucket. We're still in bucket number 1, okay? Weakness, okay? Usually incontinence, usually prolapse are all associated with that, okay? And it's usually revolved around pregnancy or getting older. Or not, you might just have a weak pelvic floor, and it does happen in males and females. So males are not left out here. It's just women talk about it more because we have babies, right? So we have a lot more going on and a lot more weight on the floor. Okay, bucket number 2 is tightness, okay? totally different type of pelvic floor dysfunction. Tightness is pain with intercourse, pain with pelvic exams, when they take out that thing, they're like, ah! Sitting on a hard seat is sort of uncomfortable, you have tailbone pain, you've got hip pain, you can pull on your back. Usually it's a pain thing when it's associated with tightness. So the pelvic floor muscles get really tight to sort of protect something, or if you have a lot of trauma with your childbirth, afterwards everything gets really tight. And then there's the third kind, which is a mixed pelvic floor. People will be like, I don't really have truly that or truly that. I sort of have a little bit of both. So, you know, they'll say if I laugh at something really hard that I didn't expect to be funny and I pee a little bit, and I went to the movies with my friends and I peed 3 times and they didn't go once. That's sort of a mix, because you have not a ton of either, you just have a little bit of both. So, I'll say to my patients, if you had to put yourself in one of these 3 buckets, which one would you put yourself in? And I sort of let them diagnose themselves, because now they have all the information, and I think it's helpful, because they can explain to me, like, I have pain with intercourse, and it's hard for me to sit on a hard seat. I'm immediately thinking bucket 2, their tightness, right? But they might forget to tell me, like, oh, I also, like, you know, I pee a little when I sneeze. Like, they might forget. So that's why I explain what is weakness, what is tightness, and what is the mix. And then I let people diagnose themselves. So if you want to secretly in your brain or write it down on a piece of paper or like put it in your phone, diagnose yourself based on that. Or you might be like, nope, I have a perfect pelvic floor. Well, good for you. That's amazing. But usually something is happening and just nobody talks about it. So that is how to diagnose pelvic floor dysfunction. Does this make sense so far? Cool. Okay, I didn't lose anyone yet? Okay, cool. Then next I go into what type of incontinence do you have? So once again, there are 3 buckets, okay? There is a stress incontinence, bucket 1. Urge, have you do a functional Kegel where you're doing it with different activities, and then in the privacy of your own home, you can add weights that go inside, and you have to do it with the weight in. So this is another thing that we have for devices that are associated with weakness of the pelvic floor. Cool. I know, there's so many fun things.
Gimme.
Yeah, and then the other question, one of the other questions was for as you get older, when you start going through menopause specifically, or maybe before, there's a dryness starts to happen. So there's less lubrication naturally. So once again, I highly recommend this. But there's also different moisturizers and washes, okay? So these are fun samples too. Another question was for odors, okay? So if there's any odors, right? We're all human, we all like have different smells, right? It's sort of an area that might be smelly. There's different washes that are very safe for the pelvic floor. And then, yes, you can.
Have you seen the commercials? It's like
Yes, I was
more
just,
than just my underarms.
yes.
stink.
So that's it's
And
called
now it's like all over.
yeah.
Like deodorant.
It's called Lume, Lume.
But it's also secret. That's a secret commercial.
Oh, okay.
More than just my underarms.
Got
stink,
it.
And it's like all
It's
over.
all over deodorant. Yep.
Yeah.
So that is also safe for the pelvic floor too. Yep. So you can put it under your arms.
Even though I've heard the Loom, but I.
Yes.
Okay.
Yeah. Yep. So that's a good thing to help with odors, if that's something that's happening to you. If it's like a very strong odor, you should always see your OBGYN for that, because it could be an infection or a UTI or something. But if it's just, you know, a light one, then this will probably do the trick. So I have those samples here too. Any question on the products? No? Okay, great, cool. So now we're gonna have some fun and do some stuff together. Now that you're not all eating, I sort of saved this for the end. Okay, so how are we doing on time? Are we good? We're good? Okay, cool. All right, so people will say, I don't know what a Kegel is. Yeah, what's a Kegel? All right, so I'm gonna teach. We're all gonna do it together. Okay. All right, so ready? So I the best way to do it in sitting is to come to the edge of your seat. Okay, so you sort of feel like your pelvic floor is touching the end of your seat, like the middle of your pelvic floor. Okay, so put a slight arch in your back. Okay, you're gonna take deep breaths all right? And like, think of what's happening down here. I'm gonna take the organs out again. Okay. So this is your floor, all right? And here's a picture if you wanna pass this around too, so you can see what's happening in the floor. All right, so in order to do a Kegel exercise properly, I said all this earlier, your clitoral hood should nod, your perineal body should lift, which is the muscle in between, and your anus should wink, okay? So,
No way.
the wink, I know, people remember the wink. So the best way to describe it, some people say try to stop your flow of urine, so if you were peeing on the toilet and somebody came in, and you were like, oh, I don't want them to know I'm in here, and you had to stop and wait till they left, that's a Kegel. Some people are like, I don't understand that. Okay, another way to describe it is if you were sucking a really thick smoothie through a really skinny straw with your pelvic floor, that's a Kegel. Or if you were going to have some gas and you had to stop it because you're in public or at work and you don't want people to smell it, that's a Kegel, right? Okay, so all of these are like, think of never pushing out, right? Never bearing down, it's always pulling in, okay? So we're gonna pull our vagina in or try to stop our flow of urine while also trying to stop gas, okay? All of that is without squeezing your buttocks, right? You don't want to squeeze your glute max together. You want to pull your pelvic floor and isolate it. Some people are like, I still don't understand it. Okay, fine. Try to pick up a pee with your pelvic floor. Okay, so there's a pee on the floor. You're going to pick it up with your pelvic floor. Okay, and then we're going to relax. All right? Does everyone feel like they sort of did it? Kind of? Okay, we can keep practicing. It's okay. All right? Some people have to pull in their transverse abdominis, which is our deep core muscle, in order to do it. You should try not to squeeze your butt, though, and squeeze your glute max. Yeah, it's hard. Yeah, I know, it's hard to, but work really hard to separate the two. All right, so now we're going to do Kegels to build our endurance. So these are Kegels with a hold, where Kegels that build our strength are more like fast ones, okay? So think of like a bicep curl. We're going to pump up that pelvic floor. All right, so first we're going to do Kegels with a hold, and then we'll do Kegel quicks. So Kegel holds, we're going to do pull the pelvic floor in and up like you're trying to stop your flow of urine. We're going to hold it for 10 full seconds, and then we're going to relax. Okay? So everyone pull your pelvic floor in and up for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. Good. Is that hard to hold it for 10 full seconds? Okay, so now we're going to do that 4 more times to show our endurance over time, okay? If you can do it, that's great, and that means you probably don't have a ton of weakness, but I won't know until I do the internal exam and feel how hard you're squeezing my finger, okay? So, ready? We're going to do that again. Ready? Pull your pelvic floor in and up for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax the pelvic floor. Good, okay? So in an exam, I'd have you do that 3 more times, okay? But for purposes of time, I won't do that. So if you can do that 5 times over time and you have a strong contraction, you're actually in a pretty good place. Now we're going to do the Kegel quicks, okay? So I'm going to have you squeeze, relax. So people that have pelvic floor tightness typically can't really do this one because they don't know how to relax in between, and they can do the squeeze, but they're like, I can't relax in between because their pelvic floor is so tight that they can't relax their muscles, okay? And that's when they need to come see me. So let's try to do 10 in a row. So go ahead and squeeze, relax, squeeze, relax, squeeze, relax. 4, good. 5, great. 6, concentrate. 7, 8, can you tell we're doing it? 9, 10, good. Was that easy, medium, or hard? Easy. Wow, you guys are strong. That's good. Yeah, good. So that's sort of how to gauge where you are muscularly with your pelvic floor, if it's weak, if it's tight, if it needs endurance training, if it needs strength training, and then base symptom-wise, if you're peeing in your pants, right? So like if you have small accidents, small, medium, or large, right? You fully lose your bladder. So these are all things people come in and see me for. Does that all sort of make sense? Mm-hmm. Great. Yeah. Cool. Any questions on camera that you'd like to ask me? Anything? Nothing. Everybody wants the camera off. Okay.
I guess I have a question.
Yes.
how beneficial or how much, I guess, of the pelvic floor is affected if you have a C-section?
Yeah, great question. So, right, so that's one of the questions at the initial evaluation, you know, I always start with, where are you from, how did you find us, and then we go into like your history of having children, if you have any children. So I'll say, you know, how many, do you have any kids, how many do you have? If it's a female, right, if it's a male, we don't ask that question. And then I'll say, how old are they boys or girls, because I care. And then I say, how did you have the baby, vaginally, C-section, were there any complications, was there anything used, like forceps or a vacuum? Because that's all important to know before I do the internal exam, what's happening with that patient's pelvic floor. And so sometimes, you know, patients will have multiple C-sections, so they have a ton of weakness in their lower abdomen. They have numbness along their incisional site of the C-section scar, which is all stuff we do at my office too. But the weight of the baby still sat on that pelvic floor for 9 months. Even though they didn't deliver vaginally, there's still the weight of the baby is very heavy, and with the relaxin hormone and the weight and the kicking. So usually it's associated with weakness because of the weight of the baby, and there's no trauma at the end coming out of the pelvic floor, because that usually turns into a tightness or a weakness depending. But yes, it is very beneficial if you have a C-section to come to pelvic floor PT, just because of what was happening for 9 months, 9+ months, like all that weight is sitting on that muscular hammock or sling. So just because the baby didn't come out that way doesn't mean it isn't affected. Does that make sense?
Mm-hmm.
Great, good question. Anyone else?
I have a question with like what you do with them, like exercise wise.
Yeah.
Because I feel like I tried to do like research on my own, because patients just like ask questions, and
Yeah.
sometimes, I mean, we all know the internet like can sometimes lead you to something like this person has
Dr.
this
YouTube.
person, yeah, like this person doesn't, and I'm like in the video, I'm like, this person actually doesn't even know what they're talking about.
Yeah.
So scratch that, and then it's like back to the drawing board. So it's like some things you feel like you can trust, some things you feel like you can't, and then
Yeah.
not knowing like what kind of guidance to give someone when they're just kind of looking for like a off the fly.
Yeah, so I would say like, because I'm, you know, you don't have to say I'm not a pelvic floor PT, but you can say because we aren't able to do a pelvic exam on you, we can't like fully diagnose you certainly, but based on the symptoms you're telling me, it sounds like you're a weakness, and it sounds like you should be doing some Kegels. You should be doing endurance Kegels with a hold to build your endurance, and then you should be doing the quick Kegels to build your strength back up, and then you should be applying those Kegels to functional exercise. So like doing a Kegel with a squat, doing a Kegel with a bridge, doing a Kegel with a lunge, you know, and sort of making it a more functional exercise where it's not just laying on a table squeezing your pelvic floor over and over, because like, that's fine, and it will strengthen it, but it's not very functional for your life. Like when you pick up your kid and you pee yourself, like, again, you know, like, so you should be like squatting and picking something up while doing a Kegel, to like train moms how to pick up their babies after they give birth, so they're not constantly changing their pants and like, you know. So I always say wear pads, wear panty liners, wear something to make you comfortable in the interim as you're building your strength, and then eventually you shouldn't have to wear it anymore. So. Yeah, whereas if they have more symptoms like a tightness, I would say you shouldn't be doing Kegels. You need to be doing more stretching and diaphragmatic breathing to reduce the intra-abdominal pressure and to open up the pelvic floor. So it's a lot of breathing, it's a lot of yoga, opening, child's pose, happy baby, stuff like that for tightness. Yeah, is that a good answer?
Yeah.
Cool, yeah, great. Any other questions?
How do you treat patients with IUDs?
Yeah, so patients with IUDs, so that's a good question. This might be my best thing. So IUDs are placed way up high, okay? So they're way up here. So when you go to the OBGYN, there's usually a picture, and it's like, this is where they check how dilated you are. I don't know if you can see that. And I can pass this around too. But it's way up here in this spot. So like, there's like 8 inches, like there's no way I'm hitting that, you know what I mean? It's way up high. So yes, you can treat patients with IUDs, and even the dilators shouldn't hit that. to size 8 is pretty long, but it shouldn't go past where you dilate, because that's actually in the uterus, so it's past the cervix. So if you want to pass that around and kind of see where that is. But yep, you treat them like anybody else. Yeah, I know, pretty cool, right? Yeah. Any other questions?
Can you speak a little bit about the pelvic floor and the nervous system?
Sure, yeah. So it's innervated by the pudendal nerve. There's lots of things that can happen with it. So the pudendal nerve, I think I touched on it earlier when we were talking about the Peloton bike and the bike seats. So compression of the nerve for long periods of time, whether it's prolonged sitting on a hard seat or like getting up and down on it. So that's like when you go to spin, I'm like, right, I don't know if you've all taken a spin class, but like they have you up, they have you down, they have you leaning, they have you doing push-ups on the thing. And you're putting constant pressure through the pelvic floor. And the nerves are right there, you know, they're like right inside of the musculature. So it's pretty easy to cause a neuralgia, cause pudendal neuralgia. Also the piriformis is part of the back part of the pelvic floor. And the piriformis sits on top of the sciatic nerve, and that's the largest nerve in our bodies. So a lot of times when that gets tight, it presses on the sciatic nerve and causes sciatica down our legs. So there is a lot of nerve stuff associated with the pelvic floor. The floor itself is more the pudendal nerve, but in the back, it's usually sciatica. So when you're pregnant, a lot of patients will come in with the weight of the baby, plus they had a previous disc thing that was asymptomatic, and then they had all that extra weight added on the front and their body. It ends up shooting down the nerve, it ends up having sciatica into your leg. So we treat a lot of sciatica in my office too. And it sort of goes hand in hand, pelvic floor, low back stuff together. So yeah, was that?
Yeah, that's
Yeah,
good, thank
cool.
you.
Great. Anything else? Good? Okay. Well, thank you so much. This was wonderful. We're going to shut off the camera and do some private questions. Thank you.